Everyone. I'm Ryan Stubbs. I'm NASAA's Senior Director of Research. Thanks for joining us and being here with us for this NASA Learning Series on arts, health, and well-being, looking at cross-sector partnerships. So we know that research is mounting, showing the benefits of the arts for individuals and communities related to health and well-being. Increasingly, state arts agencies develop initiatives to leverage the arts' positive impact on health and well-being. And the National Endowment for the Arts has been a leader in this work, investing in research and grants and forming interagency partnerships at the federal level. Also, with the support from the NEA, NASA has been conducting research to get a broader understanding of the work that state arts agencies do in the arts and health space. Soon, we'll be publishing a strategy sampler that examines a variety of state arts agency programs in arts and health, in utilizing arts and health. And this work is going to be published very soon. It's nearing completion. But today we wanted to advance the conversation in a timely manner ahead of actually publishing our work, because we know that arts and health programming may be top of mind for many state arts agencies and for all of you joining us today. The reason for that is that the Arts and Health Pilot Program is being offered as a new opportunity within your NEA Partnership Agreement applications. So given all of these exciting happenings, we've put together today's agenda to include examples from state arts agencies that are featured in our research to help with everybody's programmatic thinking around these issues. And we have our partners at the NEA here to provide a reminder about the opportunity and answer some of your questions. So let's get into it. First, I want to thank my colleagues Moshe Rhodes and Nak-Young Rhee, who are here today and have been doing the heavy lifting in our cross-sector strategies research. And for our agenda today, we have folks from South Carolina Arts Commission. So we have Amanda Noyes, the Arts and Education Accessibility Director, and also her partner in the work, Katie Hinson-Sullivan, who's a certified arts therapist and founder for the Arts and Healing Department at the Medical University of South Carolina Health. We'll also be hearing from our friends in New Hampshire at the New Hampshire State Council on the Arts, Adele Cecilia, the director, and Emily Killinger, the Arts and Health Grant coordinators. And also we have our friends from the National Endowment for the Arts here, Michael Orlov, the director of state, regional, and local partnerships and international activities, director of all things, and Laura Holman-Garatino, program manager for state and regional partnerships, and Carolyn Bartley, the strategic partnerships project manager. And with that, I will hand it over to Amanda and Katie to hear about your program.
Great. My screen shared here. Hey, hi everyone. Excited to be here with you today. My name's Amanda Noyes, and I work for the South Carolina Arts Commission. I am the Arts and Education Accessibility Director, and excited to share with you about our partnership with the Medical University of South Carolina. And with my friend and colleague here, we're going to share about the Clinical Art Therapy Initiative. So I'll hand it over to Katie to introduce herself.
Thanks for having me and thanks for listening in today. My name is Katie Hinson-Sullivan. I am a board certified and licensed art therapist and the director of the MUSC Arts and Healing Department. And just to give you a little background about the MUSC program here, MUSC is a hospital that covers a pretty wide reach across the state of South Carolina. We work locally in Charleston as well as in other hospitals around the state. But we have different arms within our program. Our creative arts therapy program, we have an inpatient team as well as an outpatient side, which we'll be speaking to today. An art curation program that's really focused in on healing spaces across our hospitals. And then we have an outreach and volunteer program as well. And also just to start us off, I think just a baseline definition of art therapy is a good place to start, since that is the work that we're doing alongside the South Carolina Arts Commission. A lot of people think of art therapy as an intervention where it is in fact a mental health field. It's a form of psychotherapy that really taps into that creative process to improve the physical, mental, and emotional well-being of individuals of all ages. Here in the hospital, we work with birth to end of life. Really, art therapy can impact just a wide range of individuals. And the focus is really on process rather than product or creating a beautiful image. In each therapy session, just like any other mental health clinician, it's very treatment goal driven. So we have a goal in mind before we even step into the room or come up with an art directive to carry out with clients or students or patients. And then sessions are led by creative arts therapists or art therapists. So you have to have a minimum of a master's degree to practice art therapy and a national registration to practice. And we just also wanted to start with how this all came about. This was a very organic start. Because we have our inpatient team here in the hospital, we were really noticing an increase of pediatric emergency room visits, specifically with youngsters who were having suicidal ideation and some other just kind of that some emotional troubles. And then in October of 2021, the 3 leading pediatric organizations put out a call for school-based mental health support, just because of the access piece, really. And we ended up partnered with another department here at MUSC called the MUSC Boeing Center for Children's Wellness. That's really just focused on all things wellness. They do a weight management program, etc. And we actually got in touch with a donor who provided some funding to do just a one-shot pilot in a local district here in Charleston, South Carolina. And we worked to implement art therapy mindfully as a tier 2 intervention within the MTSS model, which is a national model across our schools. And when I say mindfully, we really dug into the research, and the only research that we could really find on a clinical art therapy initiative within a school was in the UK. So we really wanted to do this work alongside that study, but also what fit with our South Carolina schools here. And we chose to integrate this into the MTSS framework. That is a national kind of framework. It stands for the multi-tiered systems of support. And art therapy was perfect as a tier 2 intervention. So it's really targeting specific students for art therapy. The referral source or the referrals are made alongside the schools and their MTSS teams. So those teams are our school counselors, other clinical supports, and some teachers also offer up their time to be part of the MTSS team. And so referrals are made for individuals or students that are struggling with social and emotional issues.
So around the same time that Katie is really getting the clinical art therapy initiative off the ground, she has this initial investment, I started working for the South Carolina Arts Commission, and my education is in art therapy as well. So starting for the agency, had conversations with my executive leadership, and they were really excited to explore ways that we could support the field of art therapy. They hadn't really had a path to do that up to that point. And with me starting, they gave me a little bit of freedom to think about ways that we could connect with the field. So to kind of get started, I sent an email off to the South Carolina Association of Art Therapists, and Katie was on the other side of that email. So she received that email, and I said, hey, I'm here with the Arts Commission, would love to think about ways that we could support art therapy. And it was just this perfect timing that the Clinical Art Therapy Initiative was beginning. And it really aligned with our work and our mission and vision and values for our agency as well, and supporting arts education, but supporting mental health in this way and with arts interventions. So it really just started leading to some conversations between me and Katie. We were excited to think about ways that we could connect, ways that we could support the work that was happening. So we started meeting regularly. And she started giving me updates on how the clinical art therapy initiative was forming, how it was being received. And I was bringing that back to my executive leadership, sharing the successes that they were having and thinking about ways that we could maybe support this work. So what that led to was a partnership grant that we were able to offer the MUSC Arts and Healing team. And what we observed in these initial conversations was a big opportunity for growth and a potential to have this be something that we could grow outside of just the Charleston Low Country area of South Carolina. But there was a real capacity concern. Katie is wonderful, and she got this program off the ground, but she was also managing the arts and healing department, and she needed help. So we really wanted to be able to first help her build some capacity in this program. And our first year of the partnership was about supporting a coordinator for her. So that grant allowed her to hire someone to come on board and help to build that program in a sustainable way. Katie, do you want to say anything about Michelle?
Yeah, we hired Michelle Robinson. So I think that opportunity was just magical because she is in fact an art educator. So that piece, having an art educator and an art therapist lead the charge. So she was able to speak to the schools and really make those connections and have the language of the schools, while I had the experience in the history as an art therapist building programs. So it was kind of a great start to something that has absolutely grown. So
Thank you. So yeah, Michelle was able to come on board, and in that first year of the partnership, we also started to think about, we are a state agency. Our goal and MUSC is a state agency. So two state agencies coming together and thinking about how can we start to have a statewide reach with this program, and it has to be in a sustainable way. It can't happen all at once. But in that first year, we were able to expand from them serving just the one district within Charleston County to 3 districts. So just beginning to make those connections with other schools and bringing that clinical art therapy initiative into other school districts outside of the Charleston area. At that same time, we also expanded to serve kids in a foster care group home setting and be able to offer some art therapy groups in this community setting as well. So that was our foundation year. After year 1, we were able to look at the impact and see the growth that was already happening. And we were really excited to think about ways that we could sustain this growth and continue to help the clinical art therapy program grow and continue to expand its reach. So year 2, we were able to double our financial investment within our partnership grant. Because we could see that the interest was there and that the need was there to continue to support this in additional school districts. So we were able to expand from 3 districts to 4. In the second year, they were able to serve 29 schools in each of their art therapy group cycles. During this time, they also really started honing in on some best practices in expansion and working with different schools, especially with Michelle on board. She was able to have more hands-on with the school, better communication. There was a midpoint meeting that was scheduled so that we could check in and make sure things were going well, get feedback from administrators, from the art therapist that's in the school, along with Michelle that's coordinating some of this communication, really honing in on education for teachers and staff as well, and better communication with guardians. Katie, do you have anything you want to add to that?
no, I think that's great.
Great. And then also during this time, really trying to help make sure that we're capturing what's happening, capturing the impact. So MUSC was able to connect with our research partners at the University of South Carolina to do some impact reporting and collecting data so that we're making sure that we're really telling the story of what was happening.
And we can share that impact report with everybody as well at the end.
So we are now in year 3 of our partnership. We've again been able to pretty much double our financial investment in this program because it's been a huge impact, and we're really excited about the growth. The next step in this year that we're really excited about is continuing to think about how to sustainably grow. And something that Katie's team is coming up against is finding qualified art therapists that are able to serve in a part-time capacity and doing this work within school hours. There was a capacity concern with how many art therapists that are able to do this type of work. So this year we were able to make another investment and allow MUSC to hire 2 full-time art therapists. So they're full-time employees of MUSC. But serving within the Arts and Healing Department and within the Clinical Art Therapy Initiative. And these art therapists are not only located in Charleston, they are regionally located. So we have one up in Florence County right now, and we do have one in Charleston County. So they are continuing the work of the Clinical Art Therapy Initiative, but they're also starting to move out into community art therapy opportunities as well. This year, we're looking at continued growth for the program, projected to be in 6 school districts this year and in over 32 schools. So just the growth over the last 3 years is really exciting and something that we're very proud of their team. And this is the first year they're going to be integrating dance movement therapy into one of the districts as well. Want to add anything else, Katie?
Yeah, I think another point to this too is integrating art therapy into schools. It is, in terms of a funding piece, it is not that big of a haul. When we talk about growth, it's about $20 a student per session, which is for mental health services within a school system is a pretty great deal. So just to notate that as well, if anybody is interested in integrating this.
Yeah, it's a really good point. So as we look towards the future, we are looking to continue to work towards that goal of a statewide reach. And what we would love to work towards is having a full-time creative arts therapist in all 6 of our South Carolina Arts Commission hub regions, which is just a way that we've broken up the state in when we're looking at programming. So we have a statewide reach. We have a designated art therapist that's serving the school districts in each of those hub regions and providing art therapy to the community. So we have to work slowly towards that, but that's the vision that we have in mind, is working towards the statewide reach, continued growth, and then, like Katie said, sustainability piece. We are talking with school districts who now have seen the impact and they want to have art therapy in their schools. They want to continue to have art therapy in their schools, and they're beginning to fund these programs with their own budgets as well. So really, we're able then to target grant funds into districts that maybe aren't able to fund it yet, or aren't willing to maybe make that investment yet. So we can continue to grow, but sustain the work that's already happening as well. And then we're always talking about advocating towards a licensure for arts therapists in South Carolina. We don't have a licensing right now. And that's another piece of sustainability, is being able to have licensed creative art therapists so that insurance can bill for our services and provide more sustainable opportunities as well.
And Jennifer, I see your question in the chat as well. Nebraska just got licensure. I think this is amazing. There is a state association in Nebraska. So I would recommend that you get in touch with them. And with regards to finding art therapist in your state, I don't know if there's a directory, but also there is on the ATCB website, the Art Therapy Credentials Board site, you can look up and you can see all the art therapists who are registered in the state to practice. So just throwing that out there as well. Sorry, Amanda.
No, you're good.
Great question.
I know we're coming down to the end of our time. I think this is our last slide. So just to kind of wrap things up, we're really excited about this work, and the Arts Commission on the other side, kind of like a wraparound. We're trying to think of other ways that we can support the field as a whole. So some other steps we've taken with our arts directory, so that's that listing of artists that work within the state. We've created a pathway for creative arts therapists to join that directory as well. So that's a public facing directory on our website. So you can now filter by art therapists, and it's a way that they can highlight their services. It's a way that we can elevate those that are in the field in South Carolina. And we're working to build that list, expand that list as well. And then we also have for the first year, one of our education grants is allowing for the option of using grant funds to hire an arts therapist to work in your school. So if a school is interested in bringing art therapy in, and maybe they're not in the service area of MUSC right now, they can look to our arts directory, find a credentialed art therapist, and then apply for a grant to pay to bring that art therapist in. So we're really excited about that as well, to just help schools find ways to bring this type of programming in for themselves across the state. That's what we have for you. We'd love to answer questions after our next presenters. And thank you so much. Here's our contact information if you want to follow up with us directly.
Great. Thanks so much, Amanda and Katie. Really encouraging to see the growth of the work and the impact of the work, and it integrated in communities and at the school level. So really fascinating. And we'll hand it over to Adele and Emily.
Get my screen share going for you. Can everybody see that?
Yep.
Good.
Great. All right. I'm Emily Killinger. I'm the Arts and Health Program Coordinator for the New Hampshire State Council on the Arts. I am a mid-40s white female with dirty blonde hair that's pulled back, and I'm wearing colorful dangle earrings and a orange blouse. I started in this role just shy of a year ago as a result of increased state funding for arts and health programming priorities.
Hi, I'm Adele Cecilia, Director of the New Hampshire State Council on the Arts. I'm a first-generation American of Hispanic descent. I checked the 45 to 55 box for my age. I have dark brown hair and eyes. I wear glasses, and I'm currently wearing a sage sort of green top.
Both Adele and I happen to appear in front of a New Hampshire Percent for Art project that appears at our Hillsborough Superior Court by ceramic artist Teresa Taylor. So where did it all begin? Our arts and health program began back in 2006, and it was started inside of our community arts program. At that time, applicants were limited to being within senior living facilities, and then it expanded quickly to hospitals, and then later expanded well beyond that. And then our arts and health program, since it started, it has awarded roughly 200, give or take, grants since we started 18 years ago. So some of the things that we've been doing as the program was in its early stages, we started making connections with artists working in senior residential facilities, and the Arts Council invited them to join a roster listing. This roster currently has 33 artists that are involved, and it's a detailed jurying process. The roster serves as a go-to place for artists skilled at working with and in a variety of health and wellness facilities, as well as demographics. We created a listserv or an email group created to share a variety of opportunities, news, and resources that intersect in the arts and in health. Those that sign up to receive these arts and health content specific emails can also post and share items that they come across themselves. We've provided a wealth of professional development opportunities within our arts and health program field, responsive always to the field and things that are going on. Some opportunities have included, in 2015, we partnered with Lifetime Arts to bring 2 regional workshops to our teaching artists with the purpose of learning best practices in creative aging, teaching artists qualities and qualifications particular to this sort of programming, how to design and facilitate creative aging programs, curriculum development, social engagement strategies, and the nuts and bolts of program implementation. Then in 2017, we offered a one-day workshop introducing the fundamentals of time slips, teaching participants new skills to infuse creativity into care relationships and connect with the aging community. Originally designed for people with dementia, Time Slips works to shift from the expectation of memory to the freedom of imagination. Programming that can change the way we think about late life and how to engage with elders from a time of isolation and loss to a time of growth and meaningful connection. Our Arts Council has had integrated arts conferences, which we convene every other year in the fall. In 2019, we presented an integrated arts education and arts in health conference that explored how race, socioeconomic status, trauma, and mental health uniquely inform the ways in which students learn and engage with their community. Then in the fall of 2021 and the spring of 2022, we presented a series of small group, unique experiential events held at various locations across the state. This was in collaboration with our arts education program. These were artist designed and led sessions, each event inviting only small gatherings of participants of New Hampshire educators, healthcare professionals, artists, all coming together for the purpose to connect, reflect, and heal as we made our way out of the pandemic. Then in 2023, our Arts Partnership Conference was a 2-day conference sought to explore and demonstrate that there are many paths to creativity. Art is never just one thing, it's the power of multiplicity of connections, experiences, and outcomes.
In 2020, just before the onset of the pandemic, we expanded the program to support activities that invite the community to learn about and explore a range of different public health priorities, and all with that same goal of building awareness, empathy, and reducing stigma for all of our challenges. The unique structure of our Art and Health grant program allows for projects to focus on whether it can be individual or it can be broader community health needs. And so you can see here, it's really, we try to keep the social determinants of health as defined by our National Public Health Agency for all of these different factors that connect and create different challenges throughout the day and offer some more unique solutions on how we try to navigate the world around us.
Our approach to the Arts and Health program has always been a grassroots, bottom-up way of finding what's going on in the community level, finding ways to uplift projects and bringing together partnerships. One of our longtime Arts and Health grantees is the New Hampshire Theater Project. Established in 1988, a small black box theater in Portsmouth, New Hampshire, their founding executive director, Genevieve A. Schill, she's currently our New Hampshire Artist Laureate, but in 2017, while driving to a theater gig with a few other female actresses, they came across the idea of the Elephant in the Room series. This series presents play readings and community conversations about topics that we as a society often feel uncomfortable discussing. Following the play readings, a facilitated audience conversation occurs, focusing on attitudes about the difficult ethical issues involved and our responsibility as a society to bring these issues out of the shadows and into the cultural mainstream. An integral piece of the Elephant in the Room series presentations is that the New Hampshire Theater Project collaborates with multiple social service organizations to develop these programs and provide resource guides on the subject matters. These events use live theater to create a safe and nurturing environment, which encourages both courageous and transformational conversations about our hidden Elephants in the Room, and emphasizes the importance of building empathy by looking at multiple points of view. The series have included suicide and self-harm, families navigating addiction, courageous conversations on identity and belonging, and PTS with first responders. Most recently, the New Hampshire State Council on the Art has partnered both the New Hampshire Theater Project and their Elephant in the Room series with Peace of Mind. The organization Peace of Mind had a very rich subject matter to their proposed project on elder care and navigating the difficulties and the toll it takes on caretakers and elders. Unfortunately, the grant panel felt the organizational capacity was too weak to take on the project. But we as an Arts Council recognized the potential in this project, and we built a partnership between these two organizations to get the project up and going. New Hampshire Theater Project has now conducted countless hours of interviews and research, finding many people to discuss the subject of elder care. Currently, the project is in its early stages of script writing. In order to see this project to its final stages, additional funding was needed. So the search began for production and touring funding streams. And recently, the New Hampshire Theater Project learned that they'll be receiving funds from the New Hampshire Department of Health and Human Services to complete the production of the script into video format. Just another grassroots approach to building partnerships that support existing community efforts and needs.
Another partnership spotlight that we can share began in 2019 through a grant from the Substance Abuse Mental Health Service Administration, also known as SAMHSA for short, to New Hampshire's DHHS. And through that grant, we were able to create a program, an expressive arts contest that students from 5th to 12th grade, they're welcome and encouraged to submit creative pieces about their experiences with mental health in New Hampshire. And winners are chosen by a panel of judges and with varied expertise according to their grades. They're kind of grouped like 5th to 8th graders and then 9th to 12th grade to try to keep it balanced. But there are 10 awards given out, and the youth are absolutely amazing in their outpouring and desire to help raise awareness, reduce stigma, and truly effectuate change in their own neighborhood. And we have been able to get Magnify Voices to be more of a traveling exhibit, if you will. So we'll have an award ceremony, and then for the next year, hopefully anywhere from, close to 10 places is the goal to at least have it shown around the state, but we usually hit about 6. So it's a good start because it's growing in popularity each year.
Just a quick sampling of some of our other grantees over the years are the New Hampshire Children's Hospital in the Elliott Center. The New Hampshire Department of Corrections Family Center created a Children of Incarcerated Parents camp where the children and their parents get to go to camp together. Let's see, the Racial Unity Team did an outdoor museum field trip project and many others. The New Hampshire Veterans Home was a partner project which was developed in response to COVID outbreak that infected more than half of the 100 to 120 veterans living there and more than 100 staff members. 36 residents died in a month's time. One participant of this Fraglets art project had this to say: "It was healing in an unspoken way to be able to gather with others, enjoy the moment, express ourselves and our feelings through individual small shapes that came together to form a thought, a scene, or an emotion." Just a few other grantees and partnerships that we can mention are a Crotched Mountain School of Adaptive Dance Project, Mount Washington Valley Adult Day Center, Artisan, Dover Police Charities Teen Center, the Courier Museum, and the New Hampshire Association of Healthy Aging.
I know that we're preaching to the choir here, but it's like, why do we do this? What's the real motivation and driving force behind this? Aside from those beautiful smiles on those gentlemen faces, like I love when I get to see the pictures and can truly experience the effects that we're having, because the intended positive outcomes are, reductions in stress, anxiety, depression, all of those sort of mental health symptomology is a major factor, because the arts really can improve the cognitive and sensor motor functions through that sense of accomplishment. Like, I did this. I didn't even know I could, but I can do this. And I'm also not here doing it alone. There's so many different parts and pieces into the experience that can really improve the communication between our limbic system and our cerebral cortex functioning. So, the emotions and the reasonings are talking and balancing, and that can activate dopamine, our feel-good chemical in the brain, which can provide an overall increase in both drive and concentration. So the arts truly allow the brain to utilize mental and visual imagery, which can then foster a higher awareness for both the maker and the viewer to observe and analyze the world around them, which then helps to reestablish the foundation for critical thinking and for taking your steps moving forward.
And that's what we have for you. Here's our contact information if you'd like to reach out.
Really great. Thanks, Adele and Emily. An impressive array of partnerships and activities that I know you all have been doing over the long term. So this gives us lots of food for thought. So with that, we will hand it over to Michael Orlove and our partners at the NEA to talk a little bit about the pilot program and answer questions.
Thank you, Ryan, and thanks to NASAA for inviting us to be part of this webinar. It's so great to hear what's happening in South Carolina and New Hampshire, really wonderful examples. And good to see so many faces, hoping to see a number of you, many of you in person a month from now in San Juan. So most of you know the evolution of our agency's Arts and Health pilot initiative, but worth sharing or resharing briefly. Remembering some of the conversations we all had back in Santa Fe last December around cross-sector work within the state arts agency world, that led to a more focused conversation the following month leading up to the Healing, Bridging, Thriving Summit on January 30th. And at that summit, our chair announced a $5 million initiative aimed to strengthen belonging and social connection as a dimension of improved health and well-being of individuals and communities. And we see that inspirational quote from our Surgeon General on the screen from the Healing, Bridging, Thriving Summit. And part of that funding is going to this new pilot program with the state arts agencies, where we are looking to support the integration of arts and culture into strategies that emphasize the following 4 areas: addressing social connection, belonging, and mental health through arts-driven strategies. And we just heard 2 wonderful examples from South Carolina and New Hampshire. Number 2, demonstrating how artists can serve as health ambassadors and foster connection. Number 3, supporting communities in building resilience, healing from collective experiences of trauma. And number 4, supporting field building for advancing social connection and belonging through the arts. As a key component of the arts, health, and well-being pilot program, state and jurisdictional arts agencies can apply for funds to advance, deepen, and/or expand work at the state level in driving belonging and social connection, or initiate new exploratory work for a demonstration project. And I know we want to leave time for questions, so I'm going to just throw it back to Lara and go to the next slide, where she can share a little bit more about the funding tiers and rationale behind it. So over to you, Lara.
Okay, thanks, Michael. As Michael mentioned, this optional funding is available as part of our state arts agencies partnership agreements this year, and that is supporting state arts agencies and jurisdictional arts agencies. And there are 2 tiers of funding available. The first tier provides up to $25,000, and you can see on the screen here that that's to initiate new exploratory work or a demonstration project. And then the second tier provides up to $75,000. And for this higher level, the objective is more extensive. This is to advance or deepen or expand work at the state level. And this is work that's centering arts and culture in advancing belonging, social connection, and community health. And we're not going to go into too many of the details today. Our partnership program guidelines include much more specific guidance on the available arts and health funding. Including in the guidelines, we have some examples of eligible activities, and you can read through those on our website at arts.gov. We do know that state arts agencies, though, are in the midst of compiling and maybe even finalizing the 2025 applications for our upcoming October 10th application deadline, which is definitely coming right up October 10th. But in case you are still thinking about the 2 tiers of funding, we thought we'd share one of the most frequent questions that we've been hearing as food for thought. One of the questions we're hearing most is how to decide between the first tier with awards of up to $25,000 and the second tier, which has awards of up to $75,000. And we've really left this decision of which tier makes the most sense up to the individual SAAs, but I'll mention a few things to consider. First, a reminder that all partnership awards do require a cost share match. So keep that in mind if the availability of additional match funds for your state appropriation is a question. I mentioned as well that there's more specific guidance available in the partnership guidelines. And we've been suggesting that it can be helpful to revisit the various bullet points that are included in the guidelines, both the program details document, and then there's also a step-by-step application instructions document. And in those 2 documents, you'll find more detailed explanations of the initiative's intent and some project examples. There's also a link in the guidelines to a helpful page on our website that provides additional context for SAAs on the Arts, Health, and Wellbeing pilot program. So as you decide between the 2 tiers, you'll want to consider the depth of relevance between your programming and all of the bullet points and information that is in all of these different resources. If you are considering the second tier and requesting the $75,000 amount, a few additional thoughts on that. Per the guidelines for the up to $75,000 tier, SAAs must describe how funds will lead to accomplishing the initiative objectives. For example, how what is proposed will generate new partnerships with the health sector, or if it will reach more diverse stakeholders. Maybe the intention is to shift arts and health policies at the state level and generate support for future activities at the intersection of arts and health. And for this second tier, the $75,000 tier, you do need to include information in your description about recent past arts and health programming. So you'll want to be able to demonstrate a strong track record in this realm that you're looking to build on. And then I'll just mention one other thing related to requesting arts and health funds. The narrative of the application, or the narrative section of the application that you're going to complete, gives you an opportunity to address how your plans relate to the integration of arts and culture into what could be broader community strategies to strengthen belonging and social connection. So to address this, you want to be able to explain how your arts-driven strategies are integrated into community goals or strategies that promote resilience and well-being. So with that, we also have our colleague Carolyn Bartley here, and we'll all be here to answer questions, but we'll hand it back over to Ryan and Moshe, I believe, for the Q&A session.
Yes, thank you very much. All speakers, thank you so much. This is the Q&A portion. So I have 2 questions in the chat already that I will start with, but just a reminder, if you have a question, you can raise your hand or you can put it in the chat. The first question comes from Jennifer and the second from George, and I will not pronounce either of those last names because I will absolutely butcher them. Jennifer's question, I believe this is to the entire panel. What evaluative techniques do you use to demonstrate the outcomes? Personal interviews, surveys, qualitative research, or other interventions? Looks
Hi,
like you're
Katie.
taking a moment to think about it.
Yeah, Katie here from MUSC. For our CODI work in the schools, we have done all of those, all that you've listed. We did phone interviews, not only with teachers, but also with parents and guardians. We do surveys with students after every cycle. We also, for our pilot, we did an IRB study and also used a evidence-based questionnaire. So the SDQ, the Strengths and Difficulties questionnaire, there's a ton that you can use. That's one we selected that made the most sense for the work. And then, yes, is there anything I'm missing? And then of course, the stories are the most important part. So yes, all of the above.
And thank you. That kind of gets to my question because I was curious about IRB and I'm not sure Nebraska is in a position to do that yet. So I wondered how much IRBs fit in there.
Yeah, we just wanted to do that just because we wanted that impact data like right off the bat to show that this was working. So we went that direction, but I don't necessarily think you absolutely have to do that, but it is definitely an option.
New Hampshire, do you want to add anything or?
I would just add that while in my time previous to this role, when I was at Department of Health and Human Services, we were able in the grant, let's say, that brought Magnified Voices forward to have an evaluative team. SAMHSA actually tends to require 20% of your grant award goes to evaluation for that exact return on investment. But perhaps evaluation is a piece that we'll be looking to support more clearly with whatever we apply for in this session, but also really the reports on our grants from the folks, which really is about conversations, communications, and the stories directly from the folks themselves.
Yeah, absolutely. It's those stories that come forward. You can't always, use people's images in these kinds of situations. But when it is approved, those, like we pointed out, is really where you can see the impact of things. But yes, I think that that is a key place that I think all of our grantees could use some extra help with is finding other ways to find the impacts and the statistics about what they're doing.
Thank you so much. I myself am a mainly quantitative researcher, but I prefer the stories. I mean, I love them from y'all. I love writing about them. They're the best. So I truly, truly love the stories. Thank you, George, for helping me with your last name, Sugros. That really helps. I have a very difficult name as well, Moja, in the event anybody didn't know how to pronounce that one. So George's question is to the NEA, may the cost share match come from the private sector partners with whom we will work?
Want me to I'll take that one. So because the funding will be part of your partnership agreement, the match will need to come from your state appropriation. So it'll be just like it'll be managed just like the program components that you have for folk and traditional arts and the arts ed program components as well. But let us know, let's have a conversation if you have more questions about that or want to talk more.
Thank you very much. The next question, I might butcher this, brazier or brazier. I tend to pronounce everything in French and Spanish. Watts.
Brazier is correct, the French.
Great. Sometimes the French comes in handy, but I tend to use it a lot. Are you required to use a licensed art therapist from your state? The license is not offered in our state. I'm assuming this is to the panel. I mean, to New Hampshire. And
it is not a requirement for ours. There is, a bit of if they use a artist off of our arts and health roster, they have been vetted and interviewed in an extensive process that we have developed for that. So those are kind of like a go-to set of folks. There's only 33 on it at this time, but we have a couple applications in and it is growing, but it is not a requirement that they have licensure.
And I could speak to that from from our CAUTI work within the schools too. Just from a best practice standpoint, because we're going in within the MTSS model, providing this mental health support, it is best practice to use a trained certified art therapist. And although they're not licensed in your state, they are nationally board certified art therapists that can be found across our country. And like I said earlier, the ATCB, the Art Therapy Credentials Board, can specifically tell you, names of people in your state that are board certified and have the training and the credentialing, if you're interested in using an art therapist. And I think it's all about the goal or what you want to do. And Amanda, jump in for this as well. If the goal is that mental health piece or that therapy piece, then I would highly recommend you use an art therapist. But if you're doing a more art ed based program, then I think art educators are wonderful.
Yeah, I would echo what Katie just said, and just to kind of go back to our arts directory. So that's a list of any artist that wants to go through the application process to be on the directory. For art therapists that are joining, it's a separate application that's very specific to art therapy across disciplines. So that can be music therapists, drama therapists, movement. But within the application, we do ask for their highest degree in their credentials. So those individuals that are listed there do have those highest credentials that they can receive. So we don't have the state licensure here, but they are nationally registered or whatever within their individual discipline.
Thank you. And then I think there was the follow-up on that same question to the NEA. Will the NEA require licenses?
I think I'll go ahead and step in, and Lara and Michael step in too if I mistake. I think it really depends on what your project is doing. So if you're actually providing clinical creative arts therapy, then yes, you would need to use an actual certified art therapist. But then there's also other things that get into there, like credentialing and liability. So that would be a bigger conversation. So if you're thinking about doing clinical therapy, I would say definitely reach out to the NEA so we can have a longer discussion. But if you're doing more community arts engagement or health focus that isn't actual clinical creative art therapies, then that is not a requirement.
And I'll just add that Carolyn has extensive experience in this world, having worked on the Creative Forces program for a good chunk of time. So she'll be invaluable if those questions come up. Thanks for the question. Larry, you want to answer Ryan's question about increased or additional reporting?
I didn't see it. Let me see. So in terms of the question of whether there will be increased reporting for the arts and health, and right now, based on the conversations that we're having with our grants and research offices, our understanding is that there are no plans to create additional reporting requirements for this particular part of the component. I think, and Carolyn might be able to speak more to this, but I think there'll definitely be some sort of learning opportunities throughout this process, but there isn't a current plan to require additional reporting.
And then another sorry.
I was just saying, yes, that is correct, that there is no current plan to require additional reporting.
Another question from Jared. And hey, NEA, if an SAA requests X amount, should we expect to receive X, or will it be a portion of X if awarded those arts and health funds?
I'll grab that. Thanks, Moja. And hey, Jared. Right now, the best answer is we're either going to, whether you apply for X or Y, whatever you apply for, you will get. There'll be no partial funding. That's all depending on really how many of our state arts agency partners actually request funding. At some point, we just run out of funding, but There will be no partial amounts. So you either get it or you don't. And a lot of it is just based on the availability of funds. This is a pilot and this is new for us. So we are eagerly awaiting to see what comes in.
Thank you. I believe this is another question for the NEA from IVB. Would support of ASL or audio description be eligible?
Carolyn, do you want me to start with that? And then you might have other thoughts. So I think the answer to this might depend in large part on the specifics of exactly what you're proposing, but I'll provide some comments kind of based on the way that we've talked about this before. And that is that I think that, yes, it is eligible. And when you're requesting this funding, you'll want to think about if you're focused on accessibility, how is your work in accessibility integrating your programming into these sort of broader community conversations? So with the funds really serving to kind of deepen this integration. And I don't know if Carolyn or Michael, if you have other thoughts, but that's kind of the way that we've been talking about it so far.
Yep, no, that sounds good. Just aligning it to your overall goal of building that social connection and sense of belonging.
Great, super helpful. I don't see any more questions in the chats. I don't see any hand raised. So Ryan, should it be?
Yeah, yeah, I think we can wrap things up. Obviously, your friends and colleagues are here and you've provided contact information, so there's always an opportunity to follow up. I also just wanted to mention that in this coming year, in cooperation with the NEA and with support from the NEA, NASAA is going to be helping to build some more learning in this issue area and building cohorts of support. So as we learn more about what each other are doing in the arts and health space, especially related to improving social connectedness and belonging, we'll be developing cohorts to help us learn from each other's practices. And that will also culminate in an actual in-person meeting at the end of next year to help keep furthering this work. And so really appreciate the support and the cooperation for building this work with state arts agencies and the NEA, and really appreciate everybody presenting today and help us learn from each other and learn about the opportunity. So that's all. I can just keep saying thank you, but I've probably said it enough, so we can adjourn.